Dr. Eric Janssen is a board-certified orthopedic surgeon specializing in sports medicine with an emphasis in knee and shoulder surgery. He practices at SportsMED in Huntsville, Alabama, and recently presented the following program, Why Does My Shoulder Hurt? We've provided the program in 3 parts. This video contains part 1. It will have an overview, shoulder anatomy, and an office exam for shoulder injuries.
I kind of broke this down where I'm going to go first through the non-traumatic causes. A lot of our patients will walk in and say, I'm not sure what I did, but 3 to 6 months ago I started having shoulder pain, and now I'm having a hard time reaching overhead, or it hurts when I sleep, and medication hadn't helped me, and I thought I better get this looked at. I'm not sure what's going on, but it sure is bothering me enough. And in those areas we run into primary bursitis tendonitis, arthritis type problems, frozen shoulder or stiff shoulder, problems that actually come from the neck and nerves around the shoulder, which a lot of times the spine department will refer us people over for shoulder problem when they've seen them for a neck, or a lot of times we'll see someone for a shoulder and say, hey, that's coming out of your neck, you need to go over to the spine department. Certainly you can have some problems like rotator cuff tears that occur non-traumatically, but I put them over on the traumatic side with strains and tears, instability or dislocation where the shoulder's coming out of joint or another joint around it, and fractures. To start with, just an overview, I wanted to go through the anatomy just a little bit because that'll really help. Everything's anatomy based and what we see and what happens. And then just kind of go over a little general physical examination that we do each time a patient comes in the office, which between the history and the physical, we'll have a pretty good idea almost what's going on. May not know exactly how bad, but at least we'll have a good feeling for it. And then go through the different problems, how we diagnose and treat them. So starting with the shoulder, the picture on the left shows 3 bones, the scapular shoulder blade, the humerus, which goes down the arm, and the clavicle. And then you have the joints of the glenohumeral joint, or the ball and socket, the main part of the joint that lets you move. Also where the collarbone attaches. And then that shoulder blade's held on the chest wall primarily by all the musculature around, and I'll get into that in a second. We have a complex group of ligaments. The tissue that runs around the surface of that face of that glenoid or the socket is called the labrum. So you hear today in all the athletes, hey, you had a labral tear. That's a very common thing that we hear about through the press these days. And there's numerous ligaments that attach, and on top you see the biceps tendon, the long head. There's 2 tendons that run into the biceps muscle. One comes directly out of the joint. Those are potential areas for problems. And those ligaments are contained within a capsule, and that capsule is what holds that ball and socket together statically when you look at that. And then the muscles of the rotator cuff kind of hold it together dynamically. So you have muscles on the front, top, and back of that shoulder blade that come out and encircle that ball or that humeral head that help control and stabilize that shoulder, whatever position that arm is placed in. And then finally, the big musculature, the pec, the deltoid on the front, all the muscles in the back, once again the deltoid, the lat, and the rhomboids, etc. So all those bigger muscles around that whole chest girdle will help move that arm around in conjunction with the rotator cuff. So in terms of a general examination, most times we'll kind of look and feel. We'll see how good the motion is, the strength, and then do what we call a special test based on what we think from the examination itself. So here you'll see that we start by just pressing in different areas. We'll start on the joint line in the front. We'll work our way over towards where the biceps tendon is. And a lot of times just by where the soreness is, we can get a good feel for what's happening. We'll start up on the outer side where the acromion is, and then go up to, there's a joint there that goes down through the clavicle and the SC joint. We'll work our way around where the bursa comes in, and then down the deltoid muscle, and then start up in the back and work our way around the posterior joint line or the back. Up on the trap there, and then we'll work our way around the shoulder blade and on the shoulder blade. And once again, a lot of times where they're having pain can be a real helpful diagnostic clue for us. And every patient that comes in with a shoulder problem gets this kind of exam to start. We'll look at the motion. Does the patient have stiffness? Does that hurt when we go in a certain direction? So we'll look at that real quickly like this. And if there's any abnormal motion in the shoulder, and then we'll check the strength, and just primarily a quick rotator cuff check, but it gives us an idea about the other musculature too. We'll check the top of the rotator cuff by putting the arms in that position with the arms in the side, pushing out, kind of check the back of the cuff, and then pushing inward, we'll check the front of the rotator cuff. So once again, that real brief exam in the office gives us a pretty good feel between that and the history. Okay, what do we think we're looking at in terms of problems in the shoulder?
Part 2 of Dr. Janssen's program will include non-traumatic injuries, including bursitis, tendinitis, arthritis, as well as injuries to the neck and nerves. Part 3 includes traumatic injuries, strains, tears, instability, and fractures. Both programs are on YouTube as well. For more information on shoulder injuries, their diagnosis and treatment options, go to sportsmedalabama.com, or to make an appointment with Dr. Eric Janssen, you may call 256-881-5151.